The COVID pandemic subcommittee holds its final meeting on Capitol Hill, questioning witnesses from federal health agencies. It includes officials from the CDC, FDA, NIH, and Office of Readiness and Response as witnesses. Some Congress members asked the witnesses how they are going to help restore public trust in the federal health agencies.
I was and still am critical of the CDC's messaging surrounding vaccines during the pandemic, largely because it inserted itself between the doctor-patient relationship and it discouraged patients from asking questions. It downplayed and, in fact, refuted that there was infection-acquired immunity and herd immunity. People were labeled as anti-vaxxers, radicals, and called other demeaning terms simply for questioning whether novel vaccines that had not been FDA approved were right for them.
I think it's clear that in the aftermath of our federal COVID-19 response, you need to do a lot of work. There's significant work to be done to repair the trust between the American people and our public health infrastructure.
A common response was to have more effective communication.
We had a multi-pronged approach to try to communicate the risk related to vaccines. But again, I think we have there's a number of different communities in our country, and we need to do better, I believe, at trying to reach those communities to talk to them about what are some of the issues they have with vaccine.
Some members expressed concern with possible actions from the incoming presidential administration.
While I've appreciated the forward-looking focus of this hearing, I must point out that the incoming administration poses a serious threat to undo all of the progress that our witnesses have discussed with us today. Under the false pretense of making America healthy again, President-elect Trump and RFK Jr. have committed to an extreme agenda that promises to hamstring our federal health agencies and their essential work to keep Americans safe.
The witnesses also made their cases on what programs and efforts they think are important to keep around for future crises. Other focus includes where to distribute funding and grants and how those grants are approved. Reporting in Washington, D.C., Jason Blair, NTD News.